So firstly, thank you all so much for joining us today for Bicycle Health's virtual open house. My name is Kyle Young. I'm the trainer for the enrollment department, and I'm going to be your host for this afternoon. And I, along with the other speakers of today's event, am very excited to speak with you all about Bicycle Health, the services that we provide, and the lives that we're saving every day. So thank you all again so much for taking the time out of your busy lives to learn more about what it is that we do. So I would like to go over just a couple of disclosures before we get started. So firstly, please know that this presentation is being recorded by quality assurance and training purposes. Secondly, this presentation is not intended to provide any type of medical advice and is only intended to provide the public with an overview of Bicycle Health, our program, and how it works. So during this open house, we will offer individuals suffering from addiction and their loved ones an opportunity to connect with providers, recovery coaches, and other staff of Bicycle Health from the comfort of your own home. Attendees of the event will gather information from speakers regarding program details, what Suboxone is, how it works, and the success rates of patients using Suboxone for their recovery next to other treatment methods. Attendees will also learn about Bicycle Health and our services and what sets Bicycle Health apart from some of those other addiction clinics. So our agenda for the event is as follows. So I'm going to begin by giving you all an introduction to Bicycle Health and how and why Bicycle Health was created. We also have our guest speaker, Jacqueline Bango, to talk about creating goals and sticking with them. I'm then going to bring on our clinician, Sarah Purdy, to discuss telehealth and the benefits of telehealth treatment. She's also going to speak on Bicycle Health's clinical model. In addition, a member of Bicycle Health's care team will discuss what Bicycle Health's managed care looks like while being an established patient. And then another topic that we'll be covering this afternoon is what the process looks like to enroll into Bicycle Health. And then from there, we'll go through a brief tour of the Bicycle Health app, where you'll be able to learn how the app works and how user-friendly it really is with all its different functionalities. We then have our Vice President of Partner Success, who will talk about partnership opportunities. I'm then going to conclude the open house with some time for questions from you all. So if you happen to have any questions or concerns along the way, please feel free to utilize the Q&A functionality within this Zoom meeting. And two of our senior support specialists, Gina Bompadre and Kathy Migliazza, are with us to help answer your questions. We also have Q&A help from Sarah Purdy, who is one of Bicycle Health's top clinicians. And if you notice the image to the right here, all you need to do is select the Q&A icon listed toward the bottom of your Zoom video, and a Q&A pop-up should appear, enabling you to type. And in case you're wondering, don't worry about it. You do have the option to send us questions anonymously. So let's get into it. So why are we called Bicycle Health? When our founder and developer, when our founder was developing our organization, he found a lot of similarities between addiction recovery and riding a bike. You have your uphills, you have your downhills, you can move slow or you can move fast, depending on your choice of speed for pedaling. Many times you start out with training wheels until you feel comfortable riding your bike without them. And sometimes without those training wheels, we fall off, but that's okay. The goal is to just get back on that bike, keep going, and to not let that fall deter you from continuing to ride the bike. So Bicycle Health was started about 6 years ago by our founder and CEO, Ankit Gupta. An engineer by training, Ankit wanted to create technology that had impact and meaning and realized that there was a huge need to help people suffering from addiction. At the time, fentanyl and other opioid addiction were skyrocketing. So the organization decided to focus on treating opioid addiction specifically. So after Ankit spent several months connecting with people in recovery and listening to their stories, he began building the Bicycle Health Treatment Program. Bicycle Health began as an in-person treatment center in Redwood City, California in 2019. The first clinic had about 8 staff members and about 150 patients. The clinic was really successful, but to make it even easier for patients to access care, the organization decided to start seeing patients via telehealth as well as in person. It quickly became apparent that much of the stigma that came along with addiction evaporated in the telehealth environment, and it became much easier to positively impact the lives of our patients. Telehealth makes things like caring for children or an elderly loved one so much easier, and it also makes it easier for people to stay employed and seek treatment that fit their work schedules. Travel can often impact treatment as well, along with privacy concerns. Telehealth, it fixes all these issues. So what exactly is telehealth? Telehealth is the delivery of healthcare remotely by means of telecommunications technology. I know that sounds like a bunch of jumbled fancy words, but what that basically means is telehealth allows a healthcare provider to care for a patient without an in-person office visit. So when COVID-19 hit, Bicycle Health adapted to a telehealth model, and we never looked back. Maintaining a telehealth treatment model has been a true game changer for our patients. It enables us to provide high-quality treatment from anywhere in the country. In just 3.5 years, Bicycle Health has gone from 8 staff members to almost 300. We've gone from serving patients in just one state to being licensed to treat patients in 30 states. And most importantly, we've gone from around 150 patients to more than 30,000. Our current retention rate after 30 days is 86% for insured patients compared to the industry average of 69%. Our current retention rate after 90 days is 80% for insured patients compared to the industry average of just 44%. The no-show rate for Bicycle Health patients is just 9.5% compared with 23% as the industry average. And the current age range of our patients is anywhere from 18 all the way up to 83 years of age. Bicycle Health is HIPAA compliant and is one of the only telehealth companies that employ full-time clinicians in on-call teams. In 2022, Bicycle Health was listed as one of Time Magazine's most influential companies. Our mission is to increase access to quality, affordable, convenient, and private opioid use disorder treatment for all. And our vision is to enable anyone with a chronic disease to live a healthy and fulfilling life. So as mentioned before, we are currently licensed to treat in the majority of the 50 states. So the dark orange you see on this map here indicates the states that we are presently active in, and we're working diligently to get the rest of this map filled up with orange. So let's start us off. I would love to introduce to you all Jacqueline Bango, LCSW. Jacqueline joined Bicycle Health in September of 2021 and currently serves as the Director of Behavioral Health. She is a licensed clinical social worker with 10 years of experience working with individuals with substance use disorders. She completed her bachelor's degree in social work at Providence College and earned her master's degree in social work from the University of Connecticut. She has experience working in community mental health, methadone maintenance, private practice, and prior to joining Bicycle Health, she served as the social work clinical supervisor for the Substance Use Disorders Initiative at Massachusetts General Hospital. She has extensive experience working with individuals on medication for opioid use disorder and specializes in helping people who struggle with anxiety and depression. So, thank you so much, Jacqueline, and feel free to take it away.
Thank you for the intro, Kyle. And thank you all for being here with us today. As Kyle mentioned, I am the Director of Behavioral Health here at Bicycle, and I am also still a practicing therapist here as well. So today I'm going to talk with you guys a bit about how to build goals and actually stick to them. And then I'm going to chat about the behavioral health services offered here at Bicycle Health. So we're about 5 or so weeks after the new year. And so typically around this time is when we start to lose some steam with our New Year's resolution. So hopefully this will be a timely topic to talk about. So the first strategy that can be helpful in achieving goals is to make sure that your goals are specific and concrete. So setting goals that are really vague, such as I want to be healthier or I want to spend more time with my family, can be really challenging to meet because they don't specify the logistics of how to get there. So we'd want to ask ourselves, what would it look like for you if you were healthier? Or how would you know that you would actually achieve that goal? A concrete goal can be much easier to stick to. So instead of saying, I want to be healthier, we may be more likely to achieve the goal if we use language such as, I want to take a 20-minute walk 4 times a week for the next 4 weeks. We'd be able to know exactly when and if we were successful in achieving that goal. All right, the next strategy is to write down your goals. So in a study that came out of Dominican University, participants who wrote down their goals were actually 42% more likely to achieve them than those who did not write them down. So this can be a simple intervention to do to increase the success rate of your goal. Just by writing them down, we engage our brain in a different way than just thinking about them alone. All right, next tip is to break down your goals into smaller, more easy to digest steps. So setting a large goal can feel really overwhelming. And often when we feel overwhelmed, we tend to give up. So in the case of recovery, if we say, I'm never gonna have another drink again, that can feel really overwhelming and much more scary than saying to ourselves, just for today, I'm not gonna drink. This is why the AA slogan, one day at a time, is so popular because it really does work. If we hone in on just today, we'll feel a lot less overwhelmed and the goal will feel much less daunting to us, therefore making it much easier for us to actually achieve that goal. All right, remember your why. So a lot of us don't stick with our New Year's resolutions more than a few weeks because we often give up when we stop feeling motivated. So we know it's human nature for motivation to ebb and flow. We're not going to be 100% motivated 100% of the time, and that's completely fine. So when this happens, it can be really helpful to have a list of the reasons why we set our goal in the first place. This is a common intervention done typically in early recovery, and it can be done with a recovery coach, a therapist, a provider, but we'll sit down with patients and try and get an understanding of why they're here, why they want to be sober, and what their motivations for sobriety are. Some of the reasons I've heard most recently are to be able to walk my daughter down the aisle on her wedding day, to be able to see my grandchildren grow up, or just to, stop making my depression worse with continued use. So these are all quite compelling reasons, and pulling out this list on days that are tough and days where you don't feel motivated can help put things back into perspective and keep you on track for achieving your goals. All right, next tip is sort of twofold. So we want to be sure that we're monitoring our progress, and we also want to make sure that we're celebrating the little wins along the way. So tracking progress towards our goals can help us review how we're doing and whether or not we're staying on track. I recommend using a calendar to do this. You can use your phone, calendar on your computer, whatever works for you. And the other strategy is to pencil in action steps towards your goal. So let's say your goal is to exercise and get to the gym 4 times per week. It can be helpful if at the beginning of the week you actually look at your schedule and plan out the times when you're going to go to the gym, rather than just leaving it up to chance at the end of the workday. And then the next strategy here is to celebrate the little wins. So we don't have to wait until we've completely achieved our goal to celebrate or give ourselves a little pat on the back. In AA, they give out a 24-hour chip. And I think that that's so important to really mark that milestone, because it's those small wins that eventually add up to become the big wins. Okay, so we want to make it easier on ourselves to achieve our goals by setting ourselves up for success. So on On the topic of the weight loss or healthy eating goal, if we are trying to lose 10 pounds, we can set ourselves up for success by not keeping chips or cookies or ice cream or whatever your vice is in the pantry or the freezer. And same thing goes with recovery. So if your goal is to be sober from alcohol, setting yourself up for success might mean avoiding bars or places where you know that there will be alcohol. When it's right in front of us, it can be a lot harder to say no and to stay on track with your goal. Alrighty, so we want to plan ahead for tough times. We know that there's going to be times where it's harder to stick to our goals, or where we're out of our regular routine, which can throw us off a little bit. So, for example, if we're traveling, we're going on vacation and we want to stick with our workout routine, we can call the hotel, see if they have a gym, or if not, we can find an at-home workout that we can do on our phone that doesn't require equipment. And even if it's 10 minutes, and you usually do 60 of exercise, that's okay. Something is better than nothing. And it's important to remember that it doesn't have to be all or nothing. So 10 minutes can help us to keep up that momentum and keep us on track towards our goal. From a recovery perspective, it's also important to plan ahead for tough times. And this might look a little bit different going to a wedding where you know there's going to be a lot of alcohol, if you're trying to be sober from alcohol. So ways we can plan ahead for that situation might be to establish a buddy who you can go to if you're starting to feel triggered, and make sure that you have an escape plan if you feel like you need to get out or you're feeling unsafe. All right, always pick yourself back up. So this one's important. And Kyle kind of touched on this at the beginning as well with the bike analogy. So if we blow our diet one day, it's important to remember that tomorrow is a new day and a new opportunity to start fresh with our goals. We tend to be really hard on ourselves and really critical when we make a mistake. And so one strategy that I often share with patients is to talk to themselves as if they were talking to a best friend. So if, your best friend, fell off the wagon of their diet for a day, we probably wouldn't say to them like, oh, you messed up, you should probably just give up. We'd likely say to them, hey, you made a mistake and just keep trying. So one strategy here is to watch that voice in your head. It's typically kinder and gentler when we're talking to a best friend. So we want to reserve that type of voice for ourselves when we do make a mistake or have a slip up. So if you fall off the bike, just pick yourself back up and keep on riding. Okay, and lastly, don't do it alone. So tell people about the goal that you're setting so that they can help you along the way. Hopefully to provide support, encouragement, and accountability if you start to veer off track. This can be especially important in recovery. We know that addiction can be a disease characterized by isolation, and so connection is extremely important on the recovery journey. So if you don't have friends, family, loved ones to support you, you can consider talking to a therapist who can also help you establish and stay on track with your goals. All right, and that's it for the goals, tips, and tricks. We're going to shift gears a little bit to talk about the behavioral health services offered here at Bicycle. So the behavioral health team provides 3 types of services. We offer individual therapy, educational groups, and case management, and I'll dive into each one of those a little bit. So we have therapy currently offered in 24 states. Therapy appointments can be scheduled based on a patient's clinical need. Often they start out weekly and then transition to bi-weekly and then monthly as patients progress in their recovery. Our therapists use evidence-based treatments such as cognitive behavioral therapy, dialectical behavioral therapy, motivational interviewing, mindfulness, among others. Our therapists help patients to develop goals that are personal to them and really only focus on the goals that are important to patients and the ones that they're ready and willing to work on. Some common topics discussed in therapy are, of course, learning how to cope with mental health conditions that we commonly see alongside opioid use disorder, which are depression, anxiety, and PTSD. Therapists can help patients recognize and reframe or challenge negative thoughts. They can teach distress tolerance skills, emotion regulation skills, and help patients to build self-esteem, as well as helping to create relapse prevention plans and safety plans. All right, the next service that we offer on the behavioral health team is educational groups. So these groups are therapist-led, although they are not psychotherapy. The groups are intended to be educational and informative in nature. So the therapist will usually go over a certain set of coping skills related to a topic. And here's a current list of the educational group offerings that we have on the calendar. So we offer self-care, groups about boundaries, the science of addiction, grief and loss, relationships. We have a book club that's been really well attended. So we have quite a few different educational group offerings at the moment. And then the last service that we offer is case management. So we know that recovery can be multifaceted. And so if patients have needs outside of what we're able to address here at Bicycle, we on the behavioral health team can assist with linking patients to the necessary supports out in the community. So we can help connect patients with primary care providers, a psychiatrist, an outside therapist if we don't have anyone licensed in their state, or if they need a little extra support, we can assist with referring to a higher level of care.
Awesome. Thank you so much, Jacqueline. We really appreciate the work that you do and the information that you're able to provide. So thank you so much again. All right. I would now like to bring on one of our top clinicians, Sarah Purdy, and one of our senior clinical support specialists, Gina Bompadre. So Sarah's going to start off by speaking just about our clinical model and touch on what Suboxone is and how it works. And then Gina's going to take over, and she'll be speaking with you about what it is like to be an established patient here at Bicycle Health. So without any further ado, I would like to introduce you all to Sarah Purdy. Hey, Sarah.
Thank you, Kyle. I appreciate everybody being here. Thanks for your time. And at the end of these presentations, all questions are welcome. I'm Sarah Purdy. I'm the Assistant Director of the Northeast. I've been with Bicycle almost since the very beginning, and I absolutely love what I do. All the providers you will meet has a passion for this type of program, this type of medicine. And Bicycle has created this very safe space for our patients to be able to come to us however you are, wherever you are on your journey. We call it Bicycle for a reason. It keeps moving no matter where you're at. Your established recovery, this is something that you've kind of experienced. Maybe we want to make a change. We have new goals. We're transferring, or it's brand new to you. It's a very first experience. Or any of those situations, you're not where you want to be. We can help you get there. So we create a very open space with your provider. That's the first thing we say. Everything you say is confidential unless there is a dangerous situation, which we discuss. We have to intervene, but you're in a very safe space to talk about you and your care team. So for those who might have a bit of an understanding of opioid use disorder, just like any medical condition, there's a bunch of different ways to treat it. Now, Bicycle prefers to use very safe. We are patient-centered and safety-centered. So many ways to treat. You may have heard of methadone, Suboxone, Vivitrol. What are all these doing and how are they going to relate to getting you reaching your goals? So we use buprenorphine. Suboxone is a brand. So what is that going to do? So what is withdrawal and what is addiction? You meet anybody that has any exposure to an opioid for any reason, it's going to enter the brain, right? It's going to connect to this mu receptor in the brain to have an effect, whether that's pain control, post-surgery, or a negative side effect. Not all medications give the things that we're wanting to get. For some people, we're not sure why, that receptor can have different sensations. Or when it's activated, the opioid wears off and it's still activated, causing physical concerns. So meaning once that opioid wears off, what happens? That's where withdrawal can start for some people. Sweats, upset stomach, nausea, vomiting, anywhere from mild, moderate, runny nose to extreme situations. So what buprenorphine is going to do once it enters the body, it's going to connect to that mu receptor, almost like a hole in a boat. It's going to plug it. And what that allows the body to do is to recenter, reacclimate, and stop that withdrawal system. So step one, when people come to us, oh, Kyle, you can go ahead and switch to the next one. Sorry. Next slide. So step one, if you're coming to us and you're not in the situation you want to be, we start that with an induction phase. So what that is, we're getting rid of what was there, putting something different to be able to move forward. So with the induction, we offer comfort medications. We discuss your personal history and your goals to make sure this is a safe condition to be done at home, which majority of the time it is. Rescue medications for nausea, upset stomach. We want that withdrawal process at home to be as comfortable as possible, because what withdrawal is, we have to get that opioid out, and then we're going to have a plan. You have very specific instructions with your care team, a video that shows you what to do. You have a one-on-one messaging system with your care team that we're going to slowly add that buprenorphine into that receptor. Step one, we're going to get you feeling better. Step two, we're with you the entire way. Then we're going to work on getting that maintenance dose or that maintenance level. That's the amount of buprenorphine that's going to fill the receptor to give you that quality of life, reduce symptoms, ideally once a day dosing, sometimes two, that you dose, forget, we move on, right? So during that phase of treatment, have you feeling better? We know the dose of safe medication that we're able to do at home, very convenient telemedicine visits. At that point, then we start looking at all the wonderful things you've heard before this, all the cognitive behavioral, the goals, all of these things that we're increasing the quality of life, we're making changes. And then the tail end, as you go through this journey, it keeps going. For some people, buprenorphine treatment or any opioid use disorder treatment sometimes can be long-term. Diabetes, type 1, type 2, right? Type 1, those receptors are not working well for the insulin, right? It's going to be a chronic condition without medication. It's going to be difficult to live a high quality life. Type 2 diabetes, right? There's damage too, but with some changes, some people can improve that receptor or condition. So depending what's going on in life, what kind of stressors or life changes that might be happening, meaning as you grow and change, your treatment plan grows and changes at the same time. Do we work on a small taper plan? Do we work on what our short-term goals and long-term goals are for the buprenorphine? Because it's not a cookie cutter program. It's one-on-one with what the medical side needs, what your goals are, and we try to meet in the middle to kind of reach the goals, because everything's happening on that receptor level. All services are online. One of the unique things that I've appreciated as a provider is there's a one-on-one messaging system. So I can have real messaging with my patients in real time for support, for side effects discussion, just to help somebody through these transitions. We do also, in the medical side, we're able to treat co-occurring mental health conditions because you are not one part. Everything is connected. So we also are able to treat general anxiety disorder, depression. So we're able to help with the whole component of opioid use and some mild, moderate mental health conditions. It's very common to partner those on different phases of this treatment, and having that one-on-one messaging allows us to get you the full access to care quickly. So what we've learned with Bicycle, right? I always tell people COVID did a lot for us, good, bad. I always say in the future, they're going to do so many studies on what COVID did and didn't do. But we were prepared pre-COVID to handle this type of online. We already knew it worked. We knew how wonderful it was. And with that pandemic, it brought so many people, we had access to care. Our numbers, our research, our retention rates, lives changed. It works. It's convenient, and our model definitely gets people to goal. No matter where you are on that Bicycle journey, entering first time, stable recovery, maybe we need to make changes. Bicycle can take you in where you are, create a customized care plan, one-on-one, and then have it grow with you as you grow with us. So that's the quick bread and butter of it. If you have any questions, I also answer very honestly in a safe space. If you have any questions for any of our care team, and we'll be back at the very end. So thank you so much.
All right. Thank you so much, Sarah. So up next, I'd now like to introduce you all to Gina Bompadre. So Gina is going to speak with you all about what it looks like when you're an established patient here at Bicycle Health. Go for it, Gina. How you doing?
Hi, Kyle. Thanks, everybody. Sarah, Jacqueline, and thanks for all of you for being here with us today. It's so exciting to be able to share what we do for our patients on a daily basis. So thanks for being here. Like Kyle said, my name is Gina, and I am a senior clinical support specialist in the West region here at Bicycle Health. I have been here for almost 2.5 years, and I am one of many of the village here at Bicycle Health. As a clinical support specialist, I get to witness the incredible accomplishments of our patients when they go through our program. Our patients are able to live their lives. They can maintain employment, get promotions, rebuild relationships. And having this program via telehealth allows them to be treated in the comfort of their home, or as in the bathroom, escaping the kids, or wherever is most comfortable for them at the days and times that do actually work better for them. Now, MOUD, which is medication for opioid use disorder, it's not only about medication, it involves treating our mental health, and Jacqueline spoke very deeply on that. Because of this, our patients get to have access to a one-on-one licensed therapist. They have access to group therapy, and also peer-led support groups and even care coordination. Now, some of us have been there. Some of us are on the outside looking in. If you're not comfortable at first talking with a therapist one-on-one, go to a support group, go to a group therapy session, and just sit and listen. There's so many different walks of life. There's programs and meetings every single day of the week, all hours of the day. Every single person in there has their own story that might resonate with you. Maybe your story will resonate with someone else. I always suggest just give at least one a try. You might find it helpful. And there is actually a quote that I have seen sent out to our patients from our peer support groups. And it says this: rebuilding damaged relationships or making healthy new ones can be very helpful in recovery. Our recovery support programs can help you do that. And I'm a firm believer in that as well. Now, after you've enrolled into the program, you have your first appointment scheduled. You are going to get a link to download the Bicycle Health app. This app is all you need to have your appointments and reach your care team, someone like me. Behind the scenes, your care team, us, the clinical support specialist, we are calling your pharmacy. We want to make sure that they have stock in your medication. Our goal is to make sure that your transition is as seamless as possible. So by locating your medication ahead of time, hopefully this prevents a delay in your induction that, like Sarah mentioned, and reduces the time kind of going back and forth with your care team. So now you've had your first appointment. You did it. Congratulations. We know what a huge step that you just took, and we are so proud of you. Your provider did go over with you during your appointment how to start your medication, and likely gave you an induction plan to reference. Now, if you have any questions about this, or anything for that matter, the app is the place to reach us. We're your care team, the clinical support specialist. Have you ever been to a doctor's office? The nurse, a medical assistant, they call you back, ask you a lot of questions, they get your vitals and pass you off to your provider. That's who we are. Every patient is assigned a care team, and we can help with about 90% of whatever that you need, whatever questions that you have. Once you're an established patient, we can help schedule follow-up appointments. We can check stock at different pharmacies. If you've moved, we can help address getting you seen by a different provider, updating your demographics. Maybe there's an issue at your pharmacy. We can call and sort that out for you. Maybe you need a treatment verification letter for a job or a court or something. We can help with those as well. As Sarah mentioned, you'll be doing urine drug screens. So if you have any questions about that or having trouble, we can answer those questions. Maybe you have a cold. Maybe you're wondering if a certain medication is safe to take with your Suboxone, with your buprenorphine naloxone. We can help with that as well. The list just goes on and on. Of course, if we need to reach out to your provider for any urgent medical issues, we absolutely do. You also have access to reach your provider as well. And if your provider is out of the office, we have on-call providers, we have covering providers that are also available. Now, while we are behind the scenes, we are here to support you. We want to listen to your concerns. We want to celebrate your successes. We're also going to hold you accountable. This is your program. This is your recovery, and we are here for all of it. Now, your care team is not only comprised of the medical personnel, but it also includes a highly innovative technical support and engineering team. They're always looking for ways to improve your overall app experience. This is the age of technology and things happen. We know this. Our highly skilled team is here to help resolve any unforeseen tech issues and to get things back on track as quickly as possible. We also have a dedicated financial management team. If you're self-pay or is accurate and as painless as possible. And we do understand that things happen, life comes up. So when you reach out to us in the app, we can send billing requests to the finance team, like changing a billing date, for example, or any other financial related items we can get over to them for assistance. Now, as I said before, our tech team, they do comprise a product and engineering departments, and they're trying to find the new ways to make your experience and our experience better and easier and more efficient. Recently, we have launched several new features in the Bicycle Health app that allows, as an established patient, you're able to complete tasks in the app, like rescheduling your upcoming appointment. Having this feature allows you, again, to be seen whatever fits your busy lifestyle. Some other things that can be resolved within our app now is access to resolve any past due billing payments. It's like under the resources tab, you can access your billing and you can pay any past due balances that way. Another new thing that we've just released is there's a release of information task as well now. If you have we need to get records over to a new primary care physician, or if someone is requesting your records from us and you're authorizing that, we'll have you sign this paperwork. Straightforward, it's simplified. And having these tasks at your fingertips in the app, it allows for continuation and coordination of your care without the usual hassles and delays waiting for responses and kind of going back and forth. We look so forward to sharing our latest and greatest improvements that our amazing teams are working on to make your experience with Bicycle Health the best that we have to offer. Thank you so much for being here and taking time to listen to what we do have to offer for our patients. Back to you, Kyle.
Thank you so much, Gina. All right. Next, we are now going to have the fabulous Robin Carter go over Bicycle Health's enrollment process with you and talk about how easy it is to join the Bicycle Health program. She'll go over the different options we have to enroll into our program, and then we'll go over the additional steps needed to become an established patient with Bicycle Health. So feel free to take it away, Robin.
Thanks, Kyle. Hi, everyone. We're so excited to have you all join us today. My name is Robin. I am one of the senior enrollment coordinators here at Bicycle Health and have been with the company for a little over 2 years now. And today I just want to go over how easy it is to get enrolled. So to start, we have multiple ways you can choose from to enroll into our program. From our website, you can actually find a chat functionality that will connect you with one of our enrollment coordinators, and they'll walk you through the process. Also, from our website, you have the ability to go on and schedule the perfect date and time for one of our coordinators to reach out to you. Or you can choose to enroll through our self-service option, which would involve you filling out an intake on your own and having a coordinator reach out to you once it's completed. Or you can just call straight into our phone lines. Once you do connect yourself with an enrollment coordinator, the coordinator will introduce themselves, go over the program information, as well as answer any questions that you may have. They will speak with you about our $199 monthly rate, which covers all doctor visits for that particular month, access to online support groups, access to a care team, and all of your urine drug screening kits. Once questions are answered, the enrollment coordinator will go through about a 10 to 15-minute health questionnaire with you. This questionnaire will help us gather basic health information on you to help determine if Bicycle Health is going to be a good fit for you and that you'll be a good fit for Bicycle Health. Of course, all information gathered will be kept completely confidential. During this questionnaire, the enrollment coordinator will also go over billing options with you, such as if you have insurance or if you're going to be self-pay. We are able to accept many commercial insurances, and in some states, we are able to accept Medicaid or Medicare. Once the questionnaire is completed, the coordinator will electronically send you the paperwork that you will need to complete via a text message or email. These are just standard forms that you'll fill out if you go to any kind of doctor's office. So there's a consent to treat form, a financial agreement, as well as a couple of HIPAA forms for you to fill out. You will also upload a photo of your ID. And if you're paying for treatment with insurance, you'll upload an image of your insurance as well. At the time that we do receive your completed paperwork, we can then get your appointment scheduled. We'll book your initial appointment. This appointment is going to be an hour-long slot, so you do want to keep that in mind at the time of scheduling. But after we book your initial appointment, we'll then book your 20-minute follow-up appointment. And this appointment is simply so that your provider can check in on you, see how you're doing, feeling, things like that. And your follow-up appointment will be scheduled anywhere between 2 to 5 days from your initial appointment. Alrighty, so now that your appointments have been scheduled, your paperwork will then go into processing. Our enrollment team will assist you through the registration process and ensure that everything is set up for your first appointment. Once our team has finished processing all of the paperwork, we'll go ahead and send you the Bicycle Health app for you to download onto your phone. And then all you have to do is wait for your appointment date and time.
Awesome. Thank you so much, Robin. We at Bicycle Health, we do certainly do our best to make joining our program as easy and seamlessly as possible. So awesome. So now we're going to hear from Kathleen Migliazza, and she's going to take the next few minutes to give you all some information in regard to how our app works. And you can hear all about its functionalities, its simplicity, and just how easy it is to navigate. Thank you, Kathy.
Thank you so much, Kyle. Hi, everyone. My name is Kathy Migliazza, and I am a senior clinical support specialist in the Southeast region here at Bicycle Health for a little over 3 years now. It's been such a pleasure to work with our providers and our clinical team during this time, but more importantly, getting to work with you, our patients. You all inspire me, and it's been such a wonderful experience having a hand in changing your lives. Thank you so much for letting me be a part of that. Now, let's talk about how user-friendly the Bicycle Health app truly is. Congrats, you are now enrolled. Like mentioned before, our enrollment team will help you get the app downloaded with you. Then once completed, you will open the app and click on I'm new to the app and follow the instructions to get started. If you have already done this, you will click on login. After you've logged in, you will see the second image here, which is called your home screen. This will have your name at the top and any upcoming UDS tasks and when your next appointment is scheduled for. This image shows that the patient has to complete a UDS screening due. When you get this notification, you will need to complete this within 24 hours of the request. You will click here and it will give you step-by-step instructions on how to complete your UDS test and to upload your pictures so that your provider can review them. You can also see in the image here when the next appointment is scheduled for. But before we get into all that, let's review that lower right-hand corner button that says chat. All right, so here are your chats. This is what it's going to look like. It's important to know that we are a live two-way chat and when our operations hours are. We are open Monday through Friday, 9 a.m. to 10 p.m. EST. Your two-way chat is the clinical support staff chat, as this is where you will get the most information, questions answered, and the quickest reply. You can ask about insurance, UDS questions, prescriptions, pharmacy issues, and much more. This is really your one-stop shop to get your questions answered. The other 3 chat channels are for information and updates only, which are not being monitored. The lower left-hand corner icon of the paperclip is where you can attach any pictures, notes, or documents that you are wanting to send to us as well. Such as in the second picture here is an example of a patient asking to add a new insurance card to their file. These chats are our primary form of communication whenever you need them. We are always here for you and will reply as quickly as we can. All right, so it is time for, or is almost time for your first new appointment with your provider. You're going to click on the lower left-hand button that says appointments, and you will see this screen. About 5 to 10 minutes before your appointment start time, come onto the app and click join. It's going to be in a bright green color when it's ready for you. Your provider will meet you there when it's time. Some helpful tips to ensure that you are ready for your appointment are to locate yourself in a quiet space, or feel free to use headphones. Make sure you have a strong Wi-Fi connection and test your microphone and camera to ensure that you can hear and see your provider as well as they can see and hear you. Also, please know that you cannot be driving while you are attending any of your provider appointments or support groups. The quicker you have all those things done, the smoother your appointment will start. And if you do run into any technical issues at all, you can always message us in the chat channels that we just displayed. All right, you completed your first appointment. After your appointment is done, please wait up to 1 hour before checking your Bicycle Health app again and click on the bottom button that says medications. Here is where you're going to see where your prescriptions your provider has just sent over for you and where you could pick them up from. Please make sure to call your pharmacy before making the commute over there to ensure that they have received it, it's filled, and it's ready to be picked up from you. Again, if you run into any issues at all, please reach out to us in the chat. Finally, you can also click on the bottom right-hand corner where it shows resources to find plenty of other helpful information and FAQs. I'll hand it back to you, Kyle. Thank you guys so much.
Great. Thank you, Kathy. Our engineers have worked really, really hard on making this app as user-friendly as possible. And we're always making updates and doing our best to make it easier every time. So thank you for sharing that information with all of us. All right. I would now like to bring on our final guest speaker of the afternoon, Suki Dean. Suki is going to take the next few minutes to go over the different partnership opportunities. Just as a reminder, after this portion of the event, we'll be opening the floor to you all for a live Q&A session. So again, if you have any questions, you can feel free to start submitting them now. And in the meantime, the floor is yours, Suki.
Thank you, Kyle, and thank you, everybody, for being here. I appreciate the time. And as you guys have heard from our clinical support team, there have been obviously all of the resources for our patients and in as far as providing resources. My job, on the other hand, is to look at providing resources prior to getting to Bicycle. And one of the things that we're doing is we're building relationships both with our payers and our partnerships on making sure that there's access that's available through a partner portal. So we work with some of the largest payers out there, and then we're also working with community partners to continue to bring our services to each of the individual patients. These organizations are community organizations as well as hospitals, provider groups, and then also any other third party that may support patients through their journey. Kyle, if you go to the next slide, I can go through what our partnership program looks like. So our patient referral program for our partners is relatively easy. Step one is our partners identify patients who might fit our program. They can make that referral directly to us. We take patients, as our clinicians said, where patients are in their journey. So from induction all the way to stable patients. We've taken patients and have relationships with transitions from emergency rooms, providers, residential treatment centers, and really can build a program that's necessary and ready for those patients. The other thing that we do is for these partnerships, we also have what we call our rapid referral portal. What that does is actually takes you to the top of the queue with those referrals that are coming in through the partner program for our enrollment team. And we start to get in touch with those patients relatively immediately, generally within 2 hours of receiving that. Sorry, I don't know. Generally receiving that and referral from a patient. The other thing that we do is we make sure that patients are able to see a provider. So about 90% of our patients see a provider within 72 hours to build that care program for them. And then about 75% of our patients continue to show that they're getting to a stable state with medication within 7 days. One of the things that we can do is build with this program is reporting and other capabilities that help with the continuum of care across the organizations for referrals that might be coming to us. So if you have any questions or any interest in partnering with us, feel free to contact me. Thank you.
Awesome. Thank you, Suki. All right. We would now like to spend these last few moments being able to answer any questions that you all may have. So if you do have any questions, please post them in the chat, and our team will do our best to provide you with all the answers that you need.
Alrighty, I know there's a few questions that have been asked in the chat that have been answered. I do just want to add that all of our open houses are recorded and we do upload them to our YouTube channel. So you can go back, you can rewatch this open house or any of our past open houses, and you can share those links with your family members, friends, coworkers, whoever you like. Alrighty, there was another question. Let's see. Do you have members? Let's see. Do your members have much interaction with each other? Do we have a sense of community? I believe that's the question. I know Kathy was typing. Kathy, do you want to answer that question?
Sure. Yeah, I was just going to type back that what I would recommend is in those support groups, there's definitely a great sense of community in there. The ones that I've attended have been able to kind of refer to each other as, oh, well, you're going through that. I did that. And this is how I got through it, and vice versa. So there definitely is a sense of community and helping each other out in there, which is why I highly, highly suggest the support groups are a great way to get that.
Most definitely. Thanks, Kathy. Alrighty, another question came in. Do you offer sliding scale or financial assistance? Does anyone want to answer that one?
I can answer that. As I mentioned in my portion, we do have a dedicated financial management team. So there are different billing options and financial assistance based off of certain criteria. I'm not in the financial management team, so I can't answer specifically what those things are. I do know that if a patient, say it's a financial need, let's say, kind of sliding scale type thing, I believe they qualify after the second month that they are in the program, like the second 30 days that they're in the program. But again, that is something that can be answered better by our financial management department. So reaching out actually to with the 1-800 number that we have listed here or sending an email, then we can get a little bit more information as far as that goes.
Awesome. Thank you so much. Alrighty, I know there was another question regarding statistics. I'm assuming it's with the insured versus our self-pay patients. We don't have those stats on hand right now, but we are working on getting that. So as soon as we get that information, we'll be sure to share that. Alrighty. How do we as providers or case managers get process updates on our mutual clients?
I can take that. So essentially what we can do is based on if the patient gives consent at the patient level, we can share that due to security and HIPAA compliance. We also do have options that are available from a reporting standpoint. So if they are coming in through your patient portal, we're able to give you in aggregate where the patient is in their journey, if they are enrolled, and if they continue to be part of our program from a retention standpoint, we can give those stats to you as well.
Thanks, Suki. Alrighty. I know we're at time. Do we have any more? Oh, looks like some are coming in still. We have a little bit of time to answer a couple of more. Do you have a return to use rate? Yeah, does anyone want to answer that question?
We do have a re-enroll rate. I do not have that at my fingertips, but we can definitely get that out to you.
Awesome. Well, I think that is all the questions that we have today. If anyone wants to throw any last minute questions in there, feel free.
All right, wonderful. Yeah, and also, I mean, if any questions develop going forward after this event is over, we do have an email, openhouse@bicyclehealth.com, that you can certainly send emails to, and we'll respond to you promptly. All righty, folks. So our time has come to end our open house. Again, keep that email handy, openhouse@bicyclehealth.com, just in case you have any further questions, and we'll respond back to you. If you are interested in enrolling into our program or know of anyone that would be interested in our program, you can always pick up that phone and give us a call at 844-943-2514, and you'll use extension 1. So one last time, that's 844-943-2514, extension 1. You can also visit our website, bicyclehealth.com, where you can review the other enrollment options that we spoke about, such as our chat enrollment. There's also a lot of educational literature on there to check out, where you can get a lot of questions answered as well. I would like to thank you all so much for taking the time to learn about Bicycle Health and what we're all about. I would also like to thank everyone involved that assisted with putting this event together. Thank you all for all that you've done thank you for your hard work and dedication to put this on. Have a fantastic rest of your day, everyone. Be safe, and thank you so much for your time. Bye.